So facial nerve, we know that facial nerve is the seventh cranial nerve. It consists of motor root as well as sensory root. The sensory root we call it as nervus intermedius. Okay, the facial nerve consists of functional components of the facial nerve are. They are nothing but somatomotor column. Somatomotor column means supplies the muscles of facial expression, supplies the muscles which are derived from the second branchial arch. Somatomotor column, somatomotor column, and general visceral efferent column, general visceral efferent column, general visceral efferent column, which conveys preganglionic parasympathetic fibers to the lacrimal as well as submandibular salivary glands, and also to the soft palate, and also glands of the nasal mucosa, and also general visceral afferent column, which conveys taste fibers from the anterior two-thirds of the tongue as well as from the soft palate, and also cutaneous sensations from the concha. These are the functional components of the facial nerve. Somatomotor column, which is nothing but the branchiomotor column or somatomotor column, which supplies the, can call it as branchiomotor column, which supplies the muscles derived from the second arch, branchiomotor column, and general visceral efferent, which conveys preganglionic parasympathetic fibers to the lacrimal as well as submandibular and sublingual glands, and general visceral efferent column carries sensation from the anterior two-thirds of the tongue as well as from the soft palate, and cutaneous sensations from the concha. These are the functional components. Coming to the motor nucleus, it is situated in the lower part of the pons, and here lower part of the head, just in front of the absent, above and in front of the absent nucleus. And one is motor nucleus, situated in the lower part of the pons, and next one is the superior salivatory nucleus, which is also situated nearer to the motor nucleus, which conveys preganglionic parasympathetic fibers. And also the other nuclear complex is the nucleus of tractus solitarius, which conveys taste sensations, taste fibers from the anterior two-thirds of the tongue. And also here we have and also nucleus of tractus solitarius, which conveys taste fibers from the anterior two-thirds of the tongue, and also the spinal tract of nucleus of trigeminal nerve. Spinal nucleus of trigeminal nerve, which conveys cutaneous sensations from the concha through auricular branch of vagus. Okay, motor nucleus is situated in the lower part of the pons. Superior salivatory nucleus, which conveys preganglionic. We know that motor nucleus, which supplies the branchial buccal musculature. It supplies the muscles of facial expression, and it also supplies the platysma, and also it supplies the buccal musculature and buccinator muscle, and also supplies the muscles here in the auricular muscles here. So the motor nucleus is situated in the lower part of the pons. Okay, and coming to the superior salivatory nucleus, it is situated in the superior salivatory nucleus. It is also situated nearer to the motor nucleus, and it supplies the preganglionic parasympathetic fibers. Okay, and coming to the nucleus of tractus solitarius, it receives taste fibers from the anterior two-thirds of the tongue as well as from the soft palate. Okay, and the spinal nucleus of trigeminal nerve carries a taste sensation. It receives cutaneous, not taste sensation. It receives cutaneous sensations from the concha. Okay, so these are the nuclei of the facial nerve. Coming to the motor nucleus, and here from the lower part of the pons, the motor nucleus and sensory nucleus, motor nute and sensory root emerge from the lower part of the pons between the olive, and this is the olive, and inferior cerebellar peduncle. And here what happens here is the course of the nerve consists of two parts, intrapetrous and intracranial part and extracranial part. Intrapetrosal and intracranial part. Intracranial part, and next one is the extracranial part. Two courses are present. Okay, so coming to the intrapetrosal in intracranial part here. So the intrapetrosal intracranial part, the two roots of the in the intrapetrosal intracranial part, the two roots of the facial nerve, they accompany the vestibulocochlear nerve in order to reach the internal acoustic meatus. Okay, so the facial nerve along with the facial nerve along with the vestibulocochlear nerve. Here what happens here is the facial nerve occupies the anterosuperior surface of the vestibulocochlear nerve. It presents in a groove over the anterosuperior surface of the vestibulocochlear nerve, and the sensory root intervenes between the motor root of facial nerve as well as the vestibulocochlear nerve. And here these facial nerve and vestibulocochlear nerve, they are accompanied by the labyrinthine artery, and in the lower part in the bottom of the meatus, these two roots unite. At the bottom of the internal acoustic meatus, these two roots unite, and they enter into a bony canal. That is nothing but the facial canal. Okay, and in the facial canal, first the two roots of the facial nerve unite to enter into the bony canal. Here the nerve runs downwards and forwards and make a lateral curve. In the facial canal, the nerve makes a lateral curve and runs downwards and forwards. Here the bend of the facial nerve, we call it as genu of the facial nerve. Genu of the facial nerve. It consists of pseudo-unipolar ganglions. Okay, so in the medial part of the medial wall of the epitympanic recess, epitympanic part of the tympanic membrane, on the medial wall of the epitympanic part of the tympanic membrane, the nerve makes a lateral curve, and here it presents a bulging that is called geniculate ganglion of the facial nerve, and it consists of pseudo-unipolar cells. Okay, now the nerve runs downwards about the promontory, and also fenestra vestibuli. It runs downwards above the promontory and fenestra vestibuli, and here the nerve, it is related to the medial wall of it is related to the auditors to the mastoid antrum here, and the bulging of the lateral semicircular canal, and the bulging of the lateral semicircular canal, here is the bulging of the lateral semicircular canal, and the nerve runs downwards, backwards, and here it runs along the posterior wall of the tympanic cavity, and it comes out through the stylomastoid foramen. So it reaches in the facial canal, the nerve turns laterally and forms a bulging that is called geniculate ganglion, and here the nerve runs downwards in the medial wall of the epitympanic part of the tympanic membrane. The nerve turns laterally, it makes a lateral curve, and it forms a bulging that is called geniculate ganglion, which consists of pseudo-unipolar neurons, and the nerve here turns downwards, and it is situated above the promontory and the fenestra vestibuli, and here the nerve is related to the medially, it is related to the auditors to the mastoid antrum and the bulging of the lateral semicircular canal. Laterally the nerve runs downwards along the posterior wall of the tympanic cavity, and it emerges from out to the extracranial side. It emerges from outside through the stylomastoid foramen. It comes out through the stylomastoid foramen. In the facial canal, the nerve gives one branch that is called nerve to stapedius, and it also gives at the genu, it gives one important branch that is called greater petrosal nerve. It arises from the genu of the facial nerve, and also cauda tympani nerve also arises here in the facial canal. So greater petrosal nerve to stapedius, and also cauda tympani nerve arises, and it passes through the posterior canaliculus of cauda tympani nerve. Okay, and here after emerging out to the stylomastoid foramen, the nerve runs forwards in front of the styloid process, and it enters the parotid gland through its posteromedial surface. Okay, and here what happens here is the nerve lies superficial to the retromandibular vein as well as the external carotid artery. The nerves superficial to the retromandibular vein and external carotid artery, and here the nerve in the parotid gland, the nerve divides into two trunks, temporofacial and cervicofacial. temporofacial and cervicofacial. Okay, so it covers into temporofacial and cervicofacial. This temporofacial, now we have already discussed this in while during parotid gland and also nerve supply of face, motor nerve supply of face. We have already discussed this. Again, I am repeating. In the temporofacial, it divides into temporal branch and the zygomatic branch. Temporofacial branch divides into temporal branch and zygomatic branch, which supplies the muscles of the corresponding areas. And the cervicofacial branch, it divides into buccal, marginal mandibular and cervical. Buccal, marginal mandibular and cervical. Okay, buccal, marginal mandibular and cervical. So these supplies the muscles of the which are derived from the second arm, nothing but the muscles of facial expression, nothing but frontalis and also occipitalis muscle, frontalis muscle, and also we have corrugator superciliaris, orbicular arcus, orbicular oris, levator anguli, oris, depressor labiae, inferioris. Okay, zygomaticus major, zygomaticus minor, and buccinator. All these muscles, they are supplied by the branch of facial nerve. All the muscles of facial expression, they are supplied by the branch of facial nerve. And also the cervical branch, which supplies the platysma. Okay, so the branching pattern of these nerve emerges from the anterior border of parotid gland like a goose feet, like temporal, zygomatic, buccal, marginal mandibular and cervical, like a goose feet. This branching pattern we call it as resembles goose feet, and thus branching pattern we call it as pes anserinus. Okay, so that's how it supplies the muscles of the facial expression. Okay, and here at the genu we know that the nerve gives one important branch, that is nothing but the greater petrosal branch. Here through the greater petrosal nerve, the preganglionic parasympathetic fibers, the preganglionic parasympathetic fibers, they pass through the greater petrosal nerve, and by joining with the deep petrosal nerve, nerve of pterygoid canal is formed, and through the nerve of pterygoid canal, the preganglionic parasympathetic fibers further lacrimal gland, they relay in the pterygopalatine ganglion, and the postganglionic fibers, they supply the lacrimal gland, and also through the postganglionic fibers, they supply the gland through and so the greater petrosal nerve, it arises from the genu of the facial nerve, and the greater petrosal nerve, after joining with the deep petrosal nerve, it forms the nerve of pterygoid canal, and the nerve of pterygoid canal which carries preganglionic parasympathetic fibers, they relay in the pterygopalatine ganglion, and the postganglionic fibers, they reach the gland through zygomatic as well as lacrimal nerves, and those to the soft palate and the nasal mucosa, nasal glands, they reach the gland through the greater and lesser palatine nerves. So the greater petrosal nerve is very important, which carries preganglionic parasympathetic fibers. Okay, and also the greater petrosal nerve, it also receives sensations, the taste sensations from the anterior 2/3 of the tongue also. Okay, through taste sensations not from the anterior 2/3 of the tongue, it receives taste sensations from the soft palate, through lesser palatine nerve, and they pass through the nerve of pterygoid canal, and from the soft palate, the nerve of pterygoid canal, they reach to the greater petrosal nerve. Okay, so the greater petrosal nerve also receives taste fibers from the soft palate. Okay, so the taste fibers, they pass uninterrupted through the greater petrosal nerve, and also the greater petrosal nerve, it carries preganglionic parasympathetic fibers of the lacrimal gland as well as the nasal mucosal glands. Okay, so that's about the greater petrosal nerve. And now to stapedius, we know that stapedius is the smallest muscle, and now to stapedius, which is nothing but it is also derived from the second arch. And coming to the chorda tympani now. Okay, so chorda tympani now, it arises from the facial nerve just above 6 mm above the stylomastoid foramen. This chorda tympani now, it carries taste sensations for the anterior 2/3 of the tongue, as well as the chorda tympani now, it carries preganglionic parasympathetic fibers for the submandibular and sublingual glands, because the preganglionic parasympathetic fibers, they reach the submandibular ganglion through chorda tympani nerve and through lingual nerve. Okay, and the postganglionic parasympathetic fibers also, they pass through the lingual nerve and they supply the submandibular as well as sublingual glands. And the chorda tympani nerve, it receives taste fibers from the anterior 2/3 of the tongue and the post-sulcal part of the tongue, and here they pass through the chorda tympani nerve and they pass through the facial nerve without interruption, and they finally reach the nucleus of tractus solitarius. Okay, so that's about the chorda tympani nerve, and the remaining branches we know that how it supplies the face. And about coming to the communicating branches, the facial nerve, it communicates with the auricular branch of vagus nerve. It's very important. The facial nerve, it communicates with the auricular branch of vagus nerve in the face, and it supplies the, and it carries the cutaneous sensations from the concha. Okay, and below the stylomastoid foramen, the facial nerve, it also communicates with the, the patient also glossopharyngeal nerve and also vagus nerve, and also it also communicates with the 12th cranial nerve, and these are the communications below the stylomastoid foramen. And also the facial nerve, you know that it communicates with the, because it carries the preganglionic fibers, it also communicates with the lingual nerve, and here it also communicates with the zygomatic as well as the lacrimal nerve, the facial nerve through the nerve of pterygoid canal, the relay in the ganglion, so the deep petrosal nerve. And one more thing is the facial nerve, it also communicates with the lesser petrosal nerve. Okay, so these are the various communications of the facial nerve. Okay, so the facial nerve, it arises from the lower part of the pons. It consists of motor root and sensory root, and here the facial nerve consists of two parts, two courses. One is intrapetrosal intracranial part and the extracranial part. In the intrapetrosal intracranial part, here what happens here is, after emerging from the pons, so the facial nerve makes a lateral curve, middle curve in the medial wall of the epitympanic part of the tympanic membrane, and here it makes a genu, it makes a swelling that is called a geniculate ganglion of the facial nerve, which consists of pseudounipolar neurons. It runs downwards above the promontory and penistra vestibuli, and here it is related to the aretus to the mastoid antrum and a bulging to the lateral semicircular canal, and it further runs downwards along the posterior wall of the tympanic cavity, and it emerges from the stylomastoid foramen. Okay, so that's about the intrapetrosal intracranial part of the facial nerve, and the extracranial part, it runs downwards and forwards, crossing the superior to the styloid process, and it enters the posteromedial surface of the parotid gland. And here, after passing 1 centimeter into the parotid gland, it lies above the retromandibular vein and external carotid artery, and divides into two trunks, temporofacial and cervicofacial. From the temporofacial, we have temporal and zygomatic branch arises. From the cervicofacial, buccal, marginal glandular and cervical branch arises. And here, that's about the facial nerve. And one more thing is, facial nerve, after emerging from the stylomastoid foramen, here it gives one important branch, that is posterior auricular nerve. Posterior auricular nerve, it supplies the occipitalis muscle, and also it supplies and also it gives branches to the posterior belly of digastric as well as stylohyoid muscle. So after emerging from the stylomastoid foramen, before entering into the parotid gland, the facial nerve gives three branches, that is posterior auricular nerve, and also posterior nerve to posterior belly of digastric, nerve to posterior belly of digastric, okay, and also nerve to stylohyoid. Okay, so these are the branches of the facial nerve before entering into the stylomastoid. Communications means it communicates with the vagus nerve, that is very important communication. It also communicates with the in the neck region with transverse cervical nerve, and also it communicates with the trigeminal nerve on the face for the proprioceptive impulses from the face, proprioceptive sensations from the facial muscles. It also communicates with the here with the trigeminal nerve branches. We know that the sensory nerve supply of the face is by the trigeminal nerve. The facial nerve, it also communicates with the face, trigeminal nerve on the face for the proprioceptive sensations from the facial muscles. Okay, so that's about the facial nerve. And the Columns are the branchiomotor column, supplies the branchial muscles derived from the second branch. General visceral efferent, preganglionic parasympathetic fibers and lacrimal, submandibular as well as sublingual glands. General visceral efferent fibers from the anterior two-thirds of the tongue as well as from the soft palate, and cutaneous sensations from the concha. So that's about the facial nerve.